Now, moving on to another type of dementia, which is the second leading form of dementia, is vascular dementia. And a lot of people ask me, well, what is vascular dementia? Well, vascular dementia can be caused by a gambit of things, and it's usually over a long period of time they've had issues, medical issues. So these people tend to be a little more sick. They tend to be a little more slower. They tend to still be able to handle the task at hand. But what's interesting is that you can ask a person with vascular dementia, do you think you have a memory problem? And they'll always answer yes, in 99.9% of the time. Whereas if you ask an Alzheimer's person, do you have a memory problem? In most instances, they'll go, oh no, absolutely not. I don't have any problem with my memory. I'm fit as a fiddle. Now, vascular dementia, we see this happen in people who've had a stroke or have untreated long-term hypertension, people who've had congestive heart failure, sleep apnea, alcoholism, congestive heart failure, diabetes that's gone untreated or has gone for so long that the person is not capable of managing their diabetes on a regular day, on everyday basis. There's a whole list of things that could cause vascular dementia: multiple strokes, severe head injury. It's all circulatory. It has to do with sections of the brain. So vascular dementia is, to me, much more difficult to take care of than a person who has Alzheimer's. It's a myth that all Alzheimer's patients have outbursts in crazy times and screaming and yelling and kicking and fighting. I see that, but not in every one of my Alzheimer's folks. Your vascular dementia tend to be slower to process information. The information coming in takes time for them to actually either perform the task or for them to be able to answer your question. So they need a little more time. What I see with a vascular dementia is that a vascular dementia can get up in the morning and they have what I call mud brain. They move a little slower. It's hard for them to manage the steps of their day. It's hard for them to maybe get dressed. They'll put on a sock and just sit, and then they may get dressed and put on the rest, or they may not put it on correctly, or have all their clothes on for that matter. They need assistance usually, because if they've had a stroke, they may have a left-sided or right-sided weakness, or they may have difficulty expressing what they want done. They have more verbal problems right off the bat, whereas a person with Alzheimer's will eventually get there, but we don't see that usually right up front. Word finding problems, delayed word recall, meaning that they can't answer you right away. I call this mud brain. And it usually lasts till about 10 o'clock in the morning if their usual riser around 8. From about 10 until 2, the vascular dementia client tends to be much more with the program. They can go out to lunch, they can go to doctor's appointments, they tend to engage in activities, they tend to be more social, they can do a lot of things like normal. And about 2:30, we see a change happen to them. So we go from that high cognitive time from 10 to 2 to them moving on to a different dimension. It's amazing to watch. Around 2:30, we'll see the person, especially with vascular dementia, they will look at you and say, I need to get home right now. I need to get dinner cooked for my husband and pick up my children. And this person an hour, maybe 2 hours ago, was playing bingo and socializing and doing fine, and all of a sudden now they're in a different dimension. This also happens to Alzheimer's. It's called sundowner syndrome. It's when the sun actually changes and casts shadows on the walls so that I don't recognize where I am. I don't recognize this environment. I need to get back to where I feel safe, where I feel secure. The vascular dementia folks tend to do this on a regular basis. I see it happen periodically for the Alzheimer's, usually in that mild to moderate period of time on the scale that we talked about earlier. So how does a vascular dementia differ? Well, the way that they tend to progress is they can go along fine for an entire year and do just well, and then boom, something medical will happen. They may have a flu, or they may have a cold, or they may have another stroke, or their blood pressure goes out of whack, or something medical happens, and that can cause them to decline. Then they can go along for a period of time. It could be 2 weeks, it could be 6 months, and blip, something else happens again. So they're kind of like little time bombs. They're very difficult to assess as to how they're going to progress. They can be doing fine 1 minute, and the next minute be in a crisis situation. Now, if you look at their medications, it's a balancing act. Literally, there's a list of medications. They are either having difficulty, maybe they were diabetic and they're on diabetic medication, they may be on insulin, they may be on high blood pressure medicine, high cholesterol medicine. We've been dealing with their issue for a long time to get to this arena of vascular dementia. So for them, the medication list can be a whole page or 2 pages long, and it's because we're taking care of the various systems that have gone awry or that need the help of the medication. Are these people healthy? Well, if we keep them on their medication and we keep them active, yes, but a lot of times they're kind of sickly. They tend to not initiate activities on their own, as does the Alzheimer's. They tend to not be as active physically. Maybe it's due to their paralysis on one side, or maybe it's just due to the fact that they're not interested in activities. So looking at the two, I would say that one being sickly, one being healthy is a key. It's important for you to know that. So knowing whether you're dealing with a dementia that is of a vascular type, or if you're looking at an Alzheimer's. Now, let me back up a moment and talk a little bit about the diagnosis of Alzheimer's. Most of those of you who have a family member with Alzheimer's, it's basically called Alzheimer's. But in reality, the diagnosis should read probable dementia of the Alzheimer's type, because there is no way right now to determine if a person has Alzheimer's or not. Yes, there is a gene test out there called an ApoE gene test, and what we found is that there are people who have this gene who never get Alzheimer's. So, using that as the straightforward reason for having the genetic testing done to see if you actually carry this gene is really not a definitive that you will get the disease. The only way to really tell if you have Alzheimer's is to have a brain biopsy at death. Vascular dementia, well, if you're having memory problems and you have a lot of medical problems, more than likely that's pretty much what you're dealing with. There are other forms of dementia. There are many, many forms of dementia. And to just say that the person has dementia and not know the type that you're dealing with leaves that care provider, who's that hands-on person, kind of in the dark. They don't know what that person's capable of doing and not capable of doing, whether they're healthy or not healthy. I think it's important that you have a diagnosis. There's other forms known as Lewy body dementia, which is a combination of Parkinson's and dementia, the memory loss. But these people are characteristically have hallucinations the duration of their disease and need to be on medication to help with those hallucinations. Does that mean that our Alzheimer's don't get hallucinations? No. We do see some have them periodically. Same with your vascular dementia. They can also have hallucinations or delusions. And it's important that when they do have those, that they are under the care of a physician and that they have the medications that they need to help them manage their daily routine with the medications. So what I want to do next is tell you that I'm hopefully going to be able to do a weekly segment, adding more and more to this particular video. Some of the topics I'd like to discuss with you are how do they progress, the importance of of another form of dementia that is the newest form called MCI, mild cognitive impairment, and why that's important and who that can affect. Talking a little bit more about fronto temporal dementia, which is another form of dementia that's very difficult to care for, and for the caregiver it can be just a nightmare for them. But it can also be a nightmare for those caring for them in an assisted living because they may not understand the various behaviors that come along with frontotemporal dementia. There are 5 can'ts that those people who have moderate dementia are unable to do, and I want to go through those. And there are a gambit of others. So stay tuned for more information on Alzheimer's and other forms of dementia. And know that you can contact me at the information on my blog. I am someone who comes to the home to do a memory assessment on your family members for a small fee. Otherwise, you can contact me by email or by phone at no charge. And thank you again for tuning in to Dementia.